Hi, welcome to my presentation about topics in anesthesia. I'm your host, Omar Chowdhury. This presentation is about how to prepare your patient for anesthesia, as well as what anesthesia itself is about. I hope you find this presentation very informative. Thank you. By the end of the presentation, the learner should be able to compare and contrast the three forms of anesthesia: general, regional, and local. Also, the learner should be able to describe the 4 levels of anesthesia. Also, the learner should be able to palpate levels C7 and L4 on the back of a patient. Finally, the learner should be able to manipulate a patient in such a way for a spinal or epidural needle. But wait, why do I need to learn about anesthesiology? I'm not an anesthesiologist. Well, that may be true, but understanding the anesthesiology would help you describe the procedure to the patient beforehand to help soothe their anxious nerves, as well as making you look pretty sharp in front of the anesthesiologist because you can anticipate the procedure beforehand. Sound pretty good, don't you think? Okay, now it's time to find out what you know about anesthesia. Now, don't be nervous. It's perfectly acceptable that you may not know anything about anesthesia. That's okay. I'm just trying to get an idea so we can see what you learn by the end of the presentation. So, do your best, and you have about 10 seconds per question. Good luck. Question 1. The purpose of anesthesia is to A. Eliminate pain, B. Knock the patient out, C. Paralyze the patient, D. Make the patient comfortable. Question number 2. General anesthesia means A. Controlled state of unconsciousness, B. Abolishing most sensory impulses from the nerves of an area on the body, C. Administration of oral painkillers, D. Numbing the pain in a specific area. Question number 3. Regional anesthesia means A. Controlled state of unconsciousness, B. Abolishing most sensory impulses from the nerves of an area on the body, C. Administration of oral painkillers, D. Numbing the pain in a specific area. Question 4. Local anesthesia means A. Controlled state of unconsciousness, B. Abolishing most sensory impulses from the nerves of an area on the body, C. Administration of oral painkillers, D. Numbing the pain in a specific area. Question 5. Level of anesthesia where patients respond normally to commands: A. Minimal sedation, B. Conscious sedation, C. Deep sedation, or D. General anesthesia. Question 6. Level of anesthesia with depression of consciousness: A. Minimal sedation, B. Conscious sedation, C. Deep sedation, or D. General anesthesia. Question 7. Systemic drugs are used in A. General anesthesia, B. Local anesthesia, C. Regional anesthesia, or D. Never. Question 8. The spinal level at the crest of the hips is A. C7, B. T7, C. T12, or D. L4. Question 9. The vertebrae prominens, or prominent vertebrae, is A. C7, B. T7, C. T12, or D. L4. Question number 10. For the seated patient to receive a spinal or epidural needle, you should position them A. Bending forward, B. Bending backwards, C. Leaning to the left, or D. Leaning to the right. So how about we start with general anesthesia? Well, general anesthesia is a drug-induced loss of consciousness. Now this is important. It's a loss of consciousness where the patient is not easily aroused by painful or tactile stimulation. Oh, wait. Come again? What that means is if I pinched you or yelled at you, you wouldn't react. Oh, now I get it. That's how I am with my wife. Now, general anesthesia is usually administered by a drug inhaled by the patient or by an injection given by the anesthesiologist. Now, this medication travels throughout the body, including the brain. This causes a suppression of natural reflexes such as coughing, gagging, and even breathing. This is why it's important the anesthesiologist be ready with a respirator or a bag to help the patient breathe. Now, this can be done in multiple ways, such as a mask over the patient's face or a tube taken down the patient's trachea and into the lungs to help him inflate and deflate with oxygen. Anesthesia sounds really wild. Well, are there any downsides to general anesthesia? Funny you should ask that. Actually, side effects are pretty common since the medication travels throughout your body and is absorbed by different organs such as the heart. The most common side effect happens to be nausea and vomiting. This here represents the tools that you will find in general anesthesia. Starting with the left is the blade. The blade is used to push the tongue aside to visualize the trachea and the vocal cords. Now, the blades come in different shapes and forms, but in general they have the same purpose. To the right of the blade you have the patient. Of course, the patient is the one that we're trying to take care of. To the right of the patient you'll see a long tube. This tube is inserted into the patient's trachea. This is where the medication and oxygen passes into the lungs from the anesthesiologist's tank. To the right of the tube you'll find the bag mask. This mask is used as a quick and easy way to put oxygen into the patient's lungs. To the right of the bag mask you'll find this long tube full of medication that is used to numb the airway before the endotracheal tube is placed. The reason is the endotracheal tube can be quite irritating to the trachea, so having numbing medication on board will lead to less post-operative irritation. This diagram here represents two things. On the left you will see how a patient's head is leaned slightly back helps open up the airway. This is important always in anesthesia. On the right you'll see how to hold a mask over the patient's face. Notice that two hands are used. However, if a bag mask is used, one hand is used to hold the mask down while the other hand pumps the bag. Now it's time to review your favorite subject, anatomy. First, look into the oral pharynx. Notice how the tongue sits and almost covers the whole area. This is why the blade is very important to push the tongue out of the way. Now look behind the tongue and you'll notice the epiglottis. The epiglottis is what keeps food from passing down into the trachea. It hangs right over it. So for us to put a tube down the larynx and into the trachea, we need to push the epiglottis and tongue out of the way. This is where the blade comes into play. So now that the blade is in the patient's mouth, where does it go? Well, remember the epiglottis behind the tongue? Well, as you can see in this diagram, the blade sits right into that crevice right behind the tongue and the epiglottis. Now, once you reach this point, it's important that the anesthesiologist lift in a diagonal direction, because if you use a sort of angulated and the teeth as a fulcrum, you're just going to break a few teeth. And then guess who's going to pay the dental bill? Certainly not the patient. Anyways, remember, it's in a diagonal direction when you're lifting up the jaw, and the epiglottis and the tongue move out of the way and the vocal cords can be visualized. Once the tongue is moved out of the way, the vocal cords can be visualized. Now there are 4 different grades given to the amount of vocal cord that you can see. Grade 1 means once the tongue and epiglottis is moved out of the way, you can see the entire vocal cord. While in grade 4, you can't see anything. Now notice how the blade again sits between the tongue and the epiglottis. This concludes part 1 of 3 on the approach to an anesthesia patient. Please go ahead and switch the tape.